So glad to be talking about prime joint support formula, in part because I think the theme for today is turning your weak leg into your strong leg, and this will help. My wife Sandra and I are local coordinators in the Seattle, Washington area, and I'm in private practice in orthopedics. Thanks. In fact, my specialty is something called adult reconstruction, and that basically means that I do hip and knee replacements. But as Dr. Lamb spoke about, I have been converted to the notion that prevention is better than surgery. If you think about that term, adult reconstruction, it implies that it's too late once you need me. Every time that I replace a joint, I see it as a failure of prevention. And we can do things that help to prevent the need for surgery, really. I really have incorporated these products into my practice, particularly the prime joint support formula, and I'll tell you why in just a minute. Now, I have to use this FDA's disclaimer. These statements have not been evaluated by the Food and Drug Administration, and these products are not intended to diagnose, treat, cure, or prevent any disease. So what are they for? They're really for functional and structural support of all of your joints. Now, it turns out that your likelihood of having a problem with one of your joints, with your knees, your hips, your spine, is roughly proportionate to your age. So if you're the age of 20, you probably have about a 20% chance of having some sort of joint problem. By the time you're 80, you have about an 80% chance of having some sort of joint problem. And of course, I plan to live until 120, so these odds are against me unless I do something about it. So more than 30% of adults experience some sort of joint pain, and of course, age impacts this. We need to maintain our joint health, and of course, if we have challenges with our weight, it makes it even worse. Now, it turns out that the joint is a very elegant structure. It's in fact one of the most, as an orthopedist, I think it's one of the most elegant structures in the human body. If you can imagine that your bones are made of concrete, so they don't rub against each other very well if they do. You need a cushioning surface, something like a rubber pad on top of that. That's what we call our synovium, our synovial membranes. And then you need the cartilage surface, that rubber layer. You also need the fluid layer within the joint. That's what we call our synovial fluid. It's sort of like an oil. So imagine concrete, a rubber layer, oil, a rubber layer, and concrete. That would actually glide pretty nicely. Now, you might have a structure like that in your car, but it turns out that in the human joint, the coefficient of friction, the ability to glide, is amazing. It's 10 times more slippery than a wet ice cube gliding against a sheer glass surface, if you can imagine that. It turns out that we have something called a mediated inflammatory response. Anytime we run, anytime we exercise, there's a normal inflammatory response that takes place, and that's very healthy. It allows us to adapt. Our joints become a little bit warm, the lubrication increases a little bit, and we like that. Unfortunately, in the case of joint breakdown, we produce a watery joint fluid, the structures of the joint, that rubbery membrane breaks down, and we don't do very well with that. Now, the nutraceutical community has tried to address that, and you may have heard of people taking things like MSM. Well, it turns out that MSM has inconclusive research, and it has high amounts required, gram quantities rather than milligram quantities that we find in most of the supplements, so-called fairy dust quantities in the supplements. In addition, chondroitin is another supplement you may have heard of. Unfortunately, it too has inconclusive research, and it has very poor absorption compared with something like glucosamine. So it turns out that in prime joint formula, we don't have either of those substances because we don't need them. It turns out that prime joint formula does have things we need. We just heard about pycnogenol and its great anti-inflammatory response. Glucosamine, which helps to cushion the joint. Hyaluronic acid. Now, I inject people with hyaluronic acid into their knees, and I do that every 6 months, or they could simply take hyaluronic acid in the form of the prime joint support formula and not to have those injections. And it turns out that the Japanese studies, a number of them have shown it's just as effective in terms of producing hyaluronic acid within the joint. Now, Dr. Lamb showed you many of the studies regarding pycnogenol. It turns out that pycnogenol is a wonderful anti-inflammatory, has a wonderful anti-inflammatory effect in the knee. The third clinical trial with pycnogenol on knee patients and osteoarthritis patients, 156 patients, showed that most of those patients that started with severe pain ended up with either no pain or only slight pain, and there was a 56% reduction in the pain. But pycnogenol isn't simply a pain substance or pain-reducing substance. It actually reduces or normalizes inflammation. The measure of inflammation, the so-called CRP levels, decreased by 54% in that study. So it's really remarkable. So what does Prime Joint Support Formula do? It helps to reduce our inflammation. It helps to maintain a healthy joint fluid. I kind of view it as a friction-free for the joint, or maybe a multivitamin for your joints, for all the joints in your body. It helps to promote optimal joint health, and it's very important to do that over time. Now, this slide says, what about Prime Joint Support Formula versus glucosidone? I think both are essential. Prime Joint Support Formula helps to maintain the function of the joint by giving us great joint fluid, by increasing your hyaluronic acid and normalizing it, and it's really an anti-aging product. Why Prime? Because all of us are getting older, regardless of your age. Even if you're young, you're getting older, and everybody needs it, whether you're a competitive athlete, a weekend warrior, a person standing as a cashier or as a teacher. Anybody looking to maintain their joint health needs this. And of course, you need the other products to maintain your bone health over time, especially maintaining your weight and your healthy metabolism with TLS. So I say start young to stay young. You can get this as a single product, but I would advise you to get it as part of a kit. The kits are a tremendous value, 22% off if you get the Joint Health and Flexibility Kit, and the Prime Advantage Kit, Anti-Aging Kit, is 37% off, so that's a wonderful savings. We all have the responsibility of taking care of our own joints, the joints of the family, and the people that we love, so spread the word, and I'll see you in 6 months.